So the Pandemic Compensation Initiative, I think, examines and deals with a problem that is really crucial to global health security, and that has to do with the incentivization of early reporting of events that might constitute outbreaks that might eventually have detrimental global health impact. The Compensation Initiative also has this really excellent model of bringing together a very interdisciplinary group of experts. We're working with economists, epidemiologists, physicians, global health governance experts, legal experts, and I think that's a really powerful combination of people to bring together in a room to think through some of the most thorny issues in global health security.
You know that if we talk about pandemics, it's not a matter of if, it's a matter of when. So everybody should be alerted, and we have to take precautions to make sure that when the next pandemic comes, we're ready for that. So that's why I think the compensation fund is a part of that endeavor to make sure that we are ready for future pandemics.
So for a long time, it's been clear that countries can be penalized when they report a new infectious disease early to the rest of the world. And this initiative is trying to take that on, trying to create incentives for the right actions, create incentives for countries to report as early as they can to the World Health Organization and to the rest of the world that they have a new serious infectious disease on their hands. And so this initiative is exciting because it's examining many ideas and trying to develop the best possible path for getting countries to do the right thing and for rewarding that really important action that they hopefully will take.
The earlier we react, and we can measure this in days, so just a few days earlier may result in a significant reduction in cases and in deaths. So I think if we can achieve that earlier outbreak response is implemented, that earlier we convert manufacturing capacity into the manufacture of a vaccine that might be effective. So any day that we can reduce could be a huge benefit to affected countries, affected populations, and potentially the world.
Given my background and experience recently working with African risk capacity and helping African countries to prepare for Ebola and other diseases, the importance of early response is something that we can't overlook. I think in the West Africa Ebola crisis, we picked up that if we had responded at least 2 months earlier, we could have saved a lot of lives. I think 80% of the burden and could have been averted. So early response is something that is important, and investing in that, and countries having the assurance that when they face a calamity, there will be some support, will help them put money in the front of the outbreak or epidemic, which is the preparedness, with the knowledge that response will be covered by staff support of partners.
From an insurance perspective, it is always important to do prevention rather than to incur the losses afterwards. And we know from insurance that investing in prevention is far more beneficial and effective, costs us less money as a community than if we have to pay for the damage afterwards. And that is why it is that preventing and a big outbreak through early reporting is just a very smart way of limiting the impact to the world.
I became involved in this project because I feel that making sure that funding important public health projects is prioritized. I think we in public health often think about what is the right thing to do and then don't get to how to fund it. And I think being proactive in addressing pandemics and epidemics is really important for the future of public health.
Pandemics, or in general animal diseases, 70% of human diseases are originated from animal diseases. That's why it's really important that we work together, both the human and the animal health, to be able to prevent emergence of diseases. And by doing this, we can also prevent the emergence of pandemics.
Countries face massive disincentives in terms of trade and travel barriers that are imposed on them when they do the right thing and report disease outbreaks. That's why we want to try and create a compensation mechanism to try and minimize, alleviate these economic disincentives to reporting, and create a system where there's a culture of reporting, where reporting is done rapidly, and is recognized as a huge global public health service, and that countries don't face the terrible disincentives that they currently do for doing that early reporting.